Okay, so today's discussion is about anxiety disorders, anxiety, trauma, and stressor related, as well as obsessive compulsive and related disorders. So, from this point on, you're going to be using two references: our textbook, of course, and the DSM 5. So, the DSM 5 will give us a more thorough understanding of the signs and symptoms of these disorders, while the textbook will have or will give us a more expanded explanation of the symptoms using examples, case examples. Um, so please read both because it's going to be very helpful for you to understand this better, to understand the symptoms better. Aside from that, please again take note if you're not really writing. Please start the habit. I'm not going to be uh, responsible for your lack of understanding of these things, because from this point on everything is going to be very technical. So write it down, your questions, the things that you want to clarify, um, because I will not be initiating the questions, because again I don't understand what point you don't understand in my discussion. So in the synchronous class, we're not supposed to go over this whole slides, but rather we're supposed to go over the parts that we don't understand. Okay? So it's your responsibility as adults to note what are the areas that you don't understand. Okay. So this particular chapter is going to run for 2 weeks because this is a large group of disorders. The reason why they are together in the textbook, it's because they share a common denominator, and this is about the anxiety, the feelings or the emotions of anxiety and fear. Although in your DSM-5, it's they are not clustered together, they are in different chapters. So don't worry, in the synchronous class I'll explain further how you can use or how you will be using the DSM-5. Okay, now the anxiety and the fear that we have, or these emotions that we have, as we know in our past psychology subjects, these are very useful emotions that we use for adaptation. So the problem is that when we use it too much, or when these emotions happen in situations that it's not supposed to happen. So this is why nagkaroon ng gantong group ng anxiety. And anxiety disorders are one of the most common mental health disorders out there. This is next to depression. In the States. However, in my case or in my experience as a clinician, this is usually how their concerns start. They would feel, a lot of my clients would feel anxious first, and then it would progress from that to more specific symptoms pointing to what kind of disorders they have. Okay, so these are the things that we're going to be discussing: the anxiety disorders. And then, actually, dito pa lang, matagal na tong discussion. So, I think in part 2, pagsasamahin natin si trauma and stressor-related disorders together with the obsessive-compulsive and related disorders. Okay? Alright. So, these are just of the definitions of these emotions that we have to clarify. Okay? So, with fear, when we talk about the emotion of fear, we're usually talking about something that is immediate and present oriented. So, fear usually activates our sympathetic nervous system. So, again, if you're not familiar with what the sympathetic nervous system does, or it didn't help yung pinanood natin or pinanood nyo yung Crash Course Psychology, no, Crash Course Anatomy, um, regarding the nervous system, please go through it again so you can understand this discussion better. So, when we talk about fear, ito yung in Tagalog, takot. Natatakot ka. So, if you would notice, when we feel fear, it's usually immediate and present-oriented. So, meaning to say, wala tayong fear na nararamdaman from the past or triggered by the past or triggered by the future. It's all present-oriented. Like, for example, tatawid ka tapos yung kotse papalapit na sa'yo. Diba? And the car doesn't seem to brake. So, definitely at that moment, immediate, at that moment, you would feel fear. Fear na baka masagasaan ka at you might die from it. Right? So, that particular situation would activate your sympathetic nervous system. That would either make you, tatayo ka na lang ba doon? Sa sobrang takot mo, hindi ka na nakagalaw, or tatakbo ka sa ibang direksyon para hindi ka matamaan ng sasakyan. So, fight or flight activation ang nangyayari dito. So, again, fear is immediate and present-oriented. On the other hand, we have anxiety. Anxiety is more of the sense of apprehension. And when we talk about the word apprehension, it's always future-oriented. Wala tayong apprehension at the moment, or wala tayong apprehension from the past. So, siya? Wala tayong diba pag nagsasalita tayo, wala tayong sinasabi na kinakabahan ako dahil sa nangyari dati. So, although you have pointed out something that happened in the past, you are worried. If you look at the sentence carefully, you are worried that the same thing might happen in the future because of the past. But it's not the past that's making you worried per se. Diba? What will happen in the future is the one that's making you worried. Like for example, itong upcoming midterms, diba? So, a lot of you are worrying about it right now kasi nga, especially if you're not the one to take notes carefully, or if you're not the one who read well, or hindi ka masyado nagbabasa ng mga dapat mong basahin. So, you're very much worried about that. And you feel apprehensive regarding to how you would do about the major exam. So, what are the usual symptoms that you feel anxious or you feel worried? So, you would tend to have muscle tension. So, napapansin nyo yan. Yung either parang stiff yung inyong muscles sa batok or sa shoulders, diba? And then, you would feel restless. Yan. Aligaga kayo. Hindi nyo malaman kung anong gagawin. And then, there is an elevation of the heart rate. So, yun. Sabi mo, parang kinakabahan ako. So, usually, that's how we would notice that we are worried or we are anxious. So, that's the difference between the two. However, these are similar in the sense that both fear and anxiety are both negative affect. Okay? So, next, with panic attack, ito naman yung abrupt experience of intense fear. So, notice the keywords here. So, it's abrupt. Abrupt meaning to say, hindi siya yung parang slowly na nagbi-build up, but rather it's something that happens all of a sudden. And when you have panic attack, there is the feeling of fear, but it is more intense. So, nangyayari yan, when it happens, you would have this physical symptoms of heart palpitations, chest pain, dizziness, sweating, chills, or heat sensation. So, may mga ganyan. So, again, parang yung tumataas ulit yung heart rate mo, or sometimes, ayun, parang sumisikip yung dibdib, tapos parang nahihilo, and then you would have this cold sweat, uh, or sometimes parang may part ng katawan mo na nanginginit. So, it varies from person to person. Not all of the physical symptoms are felt, but most of the time they would have this heart palpitations or chest pain, or sometimes with dizziness. And then with cognitive symptoms, ito yung kung ano yung naiisip. So, just like the panic attack, they would feel it all of a sudden na parang ayun na nawawala sila sa sarili nila, or parang feeling nila mamamatay na sila, or feeling nila naloloka na sila, or ayun parang nababaliw na sila. So that's how we feel, or that's how usually a person would feel when they have panic attacks. So usually a panic attack would peak within 10 minutes, and usually they are accompanied by these two. Yan. And a lot of people would have this kind of attack. So usually they would have what we call the limited symptom episodes. So sometimes they would just have less than 4 symptoms in total. So combined na to. So may iba na may mga clients ako na sasabihin nila na when they feel a panic attack happening, they would have heart palpitations, and ito dizziness. Then this one, cognitive, they would have this fear of losing control, or they would have this fear of dying. So less than 3. So ito yung less than 3 symptoms in total. So limited symptom episodes ang tawag dyan. So panic attacks are one of the most common mental health conditions that we see, and ang sabi is that most people have at least one panic attack in their lives. So think about it. Have you been in a panic, or have you recalled an instance wherein you had a panic attack before? So kung wala naman, it's okay. Pero again, at some point in your life, as according to the statistics, you have the probability of experiencing a panic attack. So we also have other people with severe anxiety na they have several panic attacks on a daily basis. So they would have these symptoms. Again, it doesn't have to be necessarily all of these symptoms. It varies from person to person. So titingnan mong mabuti ano ba dito yung symptoms niya. Kasi kung titingnan mo din carefully, some of these symptoms seem to be similar, so it might be confusing to know which are which. Okay? And then we also have this type of attacks which we call expected and unexpected. So, ma'am, sabi nyo kanina, panic attacks are abrupt experience. So, paano nagkakaroon ng expected type, and kung ano siya, abrupt experience siya? So, we have this unexpected. Unahin muna natin si unexpected. Kasi ito, hindi mo nga siya ine-expect, right? So, unexpected, these types of attacks would occur out of the blue. So, sometimes kahit nakaupo ka lang, wala kang ginagawa, or nanonood ka lang ng TV, or nagne-Netflix ka lang, bigla mo siyang mararamdaman. Bigla mo lang mararamdaman na may heart palpitations ka na, nahihilo ka na, or you have this cognitive symptoms already kahit nakaupo ka lang. Okay? On the other hand, pag sinabi nating expected panic attacks, ito naman yung panic attacks na may cue. Kaya siya expected. Kasi, meron kang stimulus. May stimulus na biglang nagtitrigger niyan. So, ano yung mga possible situations or stimulus na magti-trigger niyan? Pwedeng isang pangyayari or tao, right? So, like for example with events, if you tend to, if you're not experienced in public speaking, tapos kailangan mong mag-report, di ba? So, ito yung mga pwede mong maramdaman, or ito yung possible na mararamdaman mo when you are in that particular situation. So, meron din na parang na, nagkaroon na siya ng conditioned response. Like, for example, previously, nagkaroon na siya ng panic attack while passing by a certain area. And then, nung nag-pass by ulit siya dun sa certain area na yon, ayun, nagkaroon ulit siya ng panic attack. Kasi nga, that was the previous reaction before. Okay. Now, let's look at it together. Ayan. Ito ulit siya in a visual presentation. So, again, anxiety and fear are both negative affect. With anxiety, it's more a somatic symptom of tension, and it is future-oriented. So, we feel this one towards things that we cannot predict or upcoming events. Whereas with fear, it's more of a reaction of the sympathetic nervous system, and it is an immediate alarm reaction characterized by strong escapist tendencies in response to present danger or life-threatening emergencies. So, katulad nga nung example ko kanina, we feel fear pag yung parang sasagasaan tayo ng kotse, and it's not anxiety kasi nga we are in that situation at the present time, or yung tawag nyo nga ATM, diba? Whereas with anxiety, let's make it in a similar situation or context, diba? Meron kang agoraphobia, hindi ka pa nakakalabas ng bahay, you are already worried na baka masagasaan ka. So, yun. That's anxiety, what you're feeling at that moment. So, the two of these things usually can provoke or can initiate panic attack. Whereas with panic attack naman, they are more focused on fear occurring at inappropriate time. So, yun. We have the two types, the expected and the unexpected. So again, expected is wherein there's a specific stimulus that triggers it. Unexpected, walang nangyayari or walang specific cue na magti-trigger nun. Okay? Okay, so this is our first disorder. So, for a panic attack, you have to have 4 or more symptoms. Okay, again, the key number here or the magic number here is 4. Not 5, not 6, not 3, not 2, not 1. It's 4. Okay? So, 4 or more. Beginning at 4. And then, ma'am, pwedeng mas marami. Yes, pwedeng mas marami. Okay? But we start at 4. So, ito yung mga kanina, yung physical symptoms na napag-usapan natin. Sweating, ayan. Trembling or shaking. So, there are also people na parang nanginginig when they have panic attacks. They also have this feeling or sensation na parang sinasakal sila or nasasakal sila. So, again, the person themselves can tell you how they feel, so you really have to understand the situation kasi sometimes iba yung pagkaka-describe nila. And then there are feelings of chest pain or discomfort. We have that. And also nausea or abdominal stress. So with other people, they would have this thing like, and parang ayun, nasusuka sila, or their stomachs would feel parang ayun, yung parang ano ba to? Parang para kang nagdadayariya or constipated. So yun, hindi mo mala kung natatai ka ba or what not. Sometimes they have this kind of feeling. And then, ayan, feeling of dizziness, steady, lightheaded, or faint, na-mention na yan earlier. Chills or heat sensation. And then the other one, the paresthesias, ito yung parang may feeling of numbing in a specific place. Like, for example, parang hindi mo ma-feel yung arm mo or yung legs mo. So, may mga ganyan. Derealization, parang you have this sense na you're out of reality. That things around you doesn't feel real. Parang nasa dream state ka. Usually, that's how people would describe it. And then, they would have this, ayan, fear of losing control or going crazy, as well as fear of dying. Okay, so what are the things that causes or contributes to anxiety? So, with anxiety, there are polygenetic influences. So, again, napag-usapan na natin kung anong ibig sabihin ng polygenetic. There are genetic influences that might cause us to have higher probability of having anxiety as compared with other people. We have the corticotropin releasing factor, or the CRF. So the CRF is important because it activates the HPA, or this one. The HPA is the hypothalamic pituitary adrenocortical axis. So ang nakita nila recently in the neuroscience or the psychology is that malaking factor itong HPA axis na to doon sa anxiety natin, because a lot of people who have anxiety, they have seen higher levels of activity doon sa HPA axis ng mga taong to as compared with people who doesn't have anxiety. And then, with our brain circuits and neurotransmitters, so ito na tayo na naman, okay, ang nakita nila is that lower levels of GABA are associated with more anxiety. So, isa to sa mga nakikita nilang culprit as to why people have anxiety. And then we also have the noradrenergic and serotonergic systems, okay, which refer to the release of the neurotransmitter. So, deficits in the norepinephrine and serotonin are linked to greater anxiety. So, again, if you would remember doon sa movement ng mga neurotransmitters inside the neurons. Pag nabablock siya, pag nabablock si reuptake or hindi siya natatransmit ng maayos, it can cause problems doon sa ating uh, overall functioning. So, katulad nga nito, pag hindi um, pag hindi nakaayos yung ating norepinephrine and serotonin systems inside our neurons, it can have, or we will have problems with regards to the level of these two neurotransmitters. And then the imbalance level will of course lead to symptoms causing anxiety. Okay. There are also, or the limbic system is also has attributions, or also has uh, influence as regards to having anxiety. So, our limbic system, remember, it's the one that mediates between the brainstem, or the old stem nga na tinatawag natin, which senses the changes in the bodily function and communicates danger signals to the higher order cognitive cortex. So, the behavioral inhibition system, which is part of our limbic system, ito yung nag-activate ng signal from the brainstem of the unexpected events and also sends the signal to our cortex about the perceived danger. And this travels from the brainstem to the septal hippocampal system. So, ito pretty much yung nag-activate ng FFS natin, yung fight-flight system natin. Ito rin yung nag-ano sa atin na, magpanic ka na, or it's time to be alarmed and to escape the situation. So, pretty much pag we feel fear, ito yung nag-activate. However, this is also activated when we feel anxiety. Kaya tayo nagkakaroon ng ganong response na natatakot din. Kasi nga, parang we tend to react in the same manner as we feel fear. Okay. So, another is that, remember the concept of plasticity. So, the brain circuits are shaped by our environment. So, a good example of this one is when when smoking cigarettes are linked to increased risk for developing anxiety and panic. So, ito yung nakita nilang study. Bakit may ganon? If you would remember, teenagers are not supposed to be smoking, 'di ba? Parang sa society natin, it's a big no-no. So, more or less, a lot of teens would parang tumatakas para makapanigarilyo, and they would do that in hiding. So, dahil nga nagtatago sila and they know that they are not supposed to be doing this, the sense of the sense of being caught, or the danger of being caught is there. So, ito yung nagtitrain dun sa circuit nila na medyo bawal yung ginagawa mo. So, parang nagkakaroon doon or nabibuild yung reaction na magpanic, and of course the anxiety itself. So it's not just because of the environment like that, or shaping your brain like that. There are also studies that find the contents of the cigarette might have something to do with the development of the symptoms in those who would smoke. We also have Freud, or for the psychological contributions, we have Freud. So, for the psychological aspect, so ang sabi ni Freud is that our anxiety is a psychic reaction to danger. So, we all know about this one from your TOP. So, I hope you remember your TOP. So, and for Freud, it's more of a reactivation of an infantile fear situation rather than biological. It's more of how we react to danger. So like for example, yun nga, the fear, if we would look back um, doon sa kaninang situation, yung smoking, di ba? Let's say for example, you came from a strict household and then parang konting kibot, papagalitan ka na kagad. So, smoking is not a good thing, or it's a big no-no sa family nyo. So, the fact that you're doing it against your family's values, or what they told you not to do, but you're still doing it, it gives you this sense of yun nga, guilt, and thus leading to anxiety. Kasi nga, again, you're not supposed to be doing it, yet you're doing it. So, makikita mo doon na merong danger in a way in that situation, kasi nga, you're not supposed to be doing it, but you're doing it anyway. So, that's how Freud understood it. So, kaya ka nagkakaroon ng feeling of anxiety because you're doing what you're not supposed to be doing. Whereas with behaviorists, they see it as more of course, the symptoms are caused by learned associations. So, like for example, yung sige, ganoon pa rin ang gawin natin. No, yung mga estudyante ko dati, kanilang mga reaction kasi whenever they see me, or they associated the sound of my heels doon sa face-to-face class namin before with their exams. So, unwittingly, they conditioned themselves to be anxious whenever they hear my heels, or whenever they hear me coming, kasi nga it means that magkaklase na ako, and pag nagklase na ako, usually we have quizzes, we have tests. So they conditioned themselves to react in that manner whenever they hear me coming. Or for modeling, 'di ba? Tingnan natin in the aspect of modeling. It's more on seeing how your other or the people around you react to that situation. So like for example, yung mga kasi nung face-to-face pa, pretty much magkakakilala yung mga psych students. So sometimes they would ask the third years, yung mga second year na, ano yung mga subjects nyo? Ganto subjects namin. Mahirap ang test dyan, ganyan. So, parang, unwittingly, tas minsan nakikita pa ng lower years kung paano sila mag-react, yung mga third year, and in their third year subjects. So, nagkakaroon sila ngayon ng parang modeling na, ganito pala sa third year, mahirap. Ganito pala ang nangyayari sa third year. Parang lagi silang aligaga, tapos aral sila ng aral. So, natitrigger ngayon yung anxious behavior based on the behavior that they would see with the third year students. Kahit na, ano pa lang sila, second year pa lang or first year pa lang sila. We also have our beliefs about control causing the anxiety, as according to, or looking at it in a psychological perspective. So, this is usually how an anxious person would really feel about things. Like, for example, yung mga clients ko, nasasabihin nila, ay kahit ano namang gawin ko, wala namang nangyayari. So, with that one, since they feel that the situation is beyond their control, they would feel usually anxious na parang, hala, lagi akong late, ganyan. Hindi ko naman makokontrol yung pagiging late ko. It's because of the traffic, it's because of the bad commute, yung etc. etc. Hindi rin ako makasakay ng maayos kasi mahal na yung pamasahe. So, having these types of belief about the environment na you cannot control it tends to also increase the possibility of your anxiety. What about social contributions or the social factors? The social factors, marami yan. Kung titingnan natin, ano yung mga bagay-bagay na pwedeng mag-cause sa atin ng anxiety based on a social perspective or the social influences. So, first we have, of course, the biological vulnerabilities that can be triggered by stressful life events. So, we have, of course, our family. Kung maraming family problem, di ba? So, it can cause you stress, thus making you feel more anxious. Or interpersonal. So, if you're the sort of person who doesn't really have good relationship with other people, so parang nag-iisip ka na kagad na, tama ba yung sinabi ko sa kanila? Did I overstep myself? Ganon. Or parang baka nagalit sila or na-offend sila sa sinasabi ko because you're socially anxious, right? And then another would be occupational. Did I do well in my job? Dapat hindi dapat ako mapagalitan kasi baka mawalan ako ng trabaho. Pag nawalan ako ng trabaho, ano ipapakain ko sa pamilya ko? So, you see how all of these things, the things or the situations that the person is thinking of are all future-oriented, right? Walang present-oriented, walang past-oriented. All of these are future-oriented because more or less they are feeling anxious about the situation. And then educational. Sabi mahirap daw magpa-test yung prof na yan. Diba? Ang daming pinapagawa, ang hirap nung test kahit anong gawin ko, blah blah blah. Sa susunod na exam, mababa na naman ang score ko. So, again, future-oriented. Hindi pa nangyayari, nag-worry na kagad. So, those are social contributions. So, let's try to see an integrated model of anxiety. So, we have this one, triple vulnerability. Okay, so a person who has a generalized biological vulnerability, of course, that's the diathesis. Then, of course, the psychological vulnerability, the beliefs and preconceptions about or perceptions about things, and specific psychological vulnerability, how the person learned from their environment or the modeling that they have seen from their environment. So, let's look at it in a more visual manner. So, biological vulnerability. So, the person would have a genetic predisposition to a negative affect. Of course, that would make the person look at it or look at situation as, ayan, the glass is half empty. So, yan, lagi siyang irritable and then pwedeng driven din. Specific psychological vulnerability, like for example, physical sensations are potentially dangerous. So, like for example, pag may nararamdaman kang something sa sa katawan mo. So, sumakit yung masakit yung ulo mo the past few days, so parang iniisip mo, hala baka meron akong brain cancer, yung mga ganon. Or every time lalabas ka, may panic ka na kagad, or nafe-feel mo na nagpapanik ka. And then, generalized psychological vulnerability, sense that events are uncontrollable or unpredictable. So, like for example, yung kanina nga, tendency towards lack of self-esteem. So, doon sa parang iniisip mo, yung mga nag-overthink usually, na tama ba yung sinabi ko sa kanila, baka mali naman, baka na-offend sila, etc. etc. So, this can also be due to low self-esteem and of course inability to cope. Like for example, you didn't do well in your previous quiz or previous test, so sasabihin mo, wala namang hindi ko naman control yung test ni ma'am. Mahirap talaga siya magpa-test as opposed to studying better or developing better study habits in order to deal well with that particular situation. So, combining these three, yan, of course, makikita mo talaga yung tendency towards developing anxiety disorders. So, what are the comorbidity of anxiety and related disorders to anxiety? So, anxiety disorders actually have high rates of comorbidity. So, when we say comorbidity, it means meeting diagnostic criteria for multiple disorders at the same time. So, ibig sabihin, pwede ka magkaroon ng anxiety disorder and then pwede ka magkaroon ng isa pang disorder at the same time that you have been diagnosed with anxiety disorder. So, ang mga common with anxiety disorder, recent, yung mga nakita ko recently with my clients, they have anxiety disorder and mood disorder at the same time. So, and your text also tells you that people with anxiety disorders or people with anxiety, usually major depression is the most common additional disorder. So, ayan. So, what are the commonalities of the disorders, features, and vulnerabilities? So, makikita natin yan sa DSM-5. Ano ba yung features ng disorder? And then, makikita din natin doon yung mga differential diagnosis na hindi yan anxiety disorder, it might be another disorder. Or, ayun nga, yung what are the other related disorder that might be that particular anxiety disorder. Okay? And then, it also have high links with physical disorders. Like, for example, if you tend to have arthritis, allergies, like that, migraine. So, studies show that you tend to have higher risk or higher levels for anxiety if you have these types of condition. Okay, so what about suicide? Suicide rate attempts for people who have anxiety, about 20% of people with panic disorder attempt suicide. This is because of the cognitive symptom, yun nga, yung fear of dying, fear of losing their mind. So, this is why they attempt. However, hindi naman ganun kataas yung completed ang suicide. By the way, suicide, we don't call it successful suicide, we call it completed. Meaning to say, ayun, namatay nga sila due to suicide. So, the attempts is similar to major depression or mood disorders. However, in terms of the completed rates, magkaiba sila ng number. So, there is a suicide risk na nag-increase for all types of anxiety disorder. And then, of course, ayan, is it comorbid with depression? So, the answer is that it depends. There are some of my clients before who were asking, since I was diagnosed with anxiety, does it mean I have depression as well? So, they have these types of questions. So, it's my job to clarify it. So, sinasabi ko na, no, you didn't really show any symptoms for depression, and having anxiety disorder is quite different from having depressive disorders. So, kinaklarify ko yun sa kanila. Kasi nga, since they have anxiety disorder, they tend to worry na baka maging depressed na rin sila. So, yun yung mga usual na nangyayari. Okay, so these are the group of anxiety disorder. Again, for part 1, we'll just focus on this one. So, hopefully, makaya siyang ma-discuss within 1.5 or however, I'm already over 48 minutes just discussing the preliminaries. Okay, so we have generalized anxiety disorder or GAD. We have, of course, the panic disorder and agoraphobia. So, these two are quite different. Then, we have the specific phobias. Ito yung mas alam natin or mas alam nyo. We also have the social anxiety disorder, separation anxiety disorder, and selective mutism. Okay, so let's go first to generalized anxiety disorder. So, in the DSM-5, makikita nyo may discussion muna bago ang symptoms, the criteria for GAD. So, with the DSM-5, they do the overview. Ito yung features niya. So, what do we mean by with generalized anxiety disorder? So, usually, there is an excessive anxiety and worry occurring more days than not for at least 6 months. So, ito yung mga magic numbers na kailangan nating intindihin with the disorders. So, ang kailangan nating i-remember ng mga magic numbers kung ilang symptoms ang kailangan for it to be that disorder, and then kung gaano katagal na nagmamanifest yung ganong symptoms. So, like for example, with the GAD, kailangan for at least 6 months. And then, yung 6 months na yon kailangan nagmamanifest yung kanyang anxiety frequently. Siguro in a week, mga 4 times a week, ganon. So, wala siyang sinasabi. Kung makikita nyo, wala siyang sinasabing how more are more in the days that you have said here. So, it's really up to the clinician to judge it. Ano ba yung more na yon? And, ang ating ano lang talaga dito is that for the past 6 months, ganun siya. And then, another feature of GAD is that the worry is difficult to control. Yung kahit sabihin sa'yo na, oh, don't worry about it. At the back of your mind, you're still worrying. Na parang, paano kung gano'n? Anong mangyayari? Paano kung ganyan, ganyan. So, that is one of the symptoms or one of the features. So, anxiety and worry are associated with other physical symptoms. So, like for example, nafe-feel mo yun, sumasakit nga yung ulo mo. And it's because you are worrying about these things. Or you are anxious about these things. Or nafe-feel mo nga na parang, ano ba to? May palpitations ka or chest pain ka whenever you think about these things that you're worrying about. And then, the anxiety causes clinically significant distress or impairment. So, because of worrying too much, hindi ka na nakakakain, naapektuhan na yung pagtatrabaho mo or yung mga ginagawa mo. You're also quite irritable. around other people because of this worry. And it shouldn't be because of substance use or medical condition. So, ito yung mga kailangan um, yung kumbaga, alisin na kaagad sa picture kung anxiety disorder. We have to make sure na hindi siya because of substance use or medical condition. So, there are, by the way, specific or, drugs or prescriptions that causes similar physical symptoms as that of anxiety. So, like for example, ayun yung aking medications for asthma before, isa sa mga side effects niya ay palpitation. So, baka kasi ma-confuse yon. Minsan, may mga ganong, kaya tinatanong sa history, yung medical background, or yung medical history. Kasi nga, you have to eliminate these things in order for you to be able to diagnose accurately. And then, the anxiety should not be better explained by another mental disorder. Eh, ma'am, sabi nyo kanina may comorbidity. Yeah, we have to make sure that the person or the anxiety is really the main feature, and the anxiety is not caused by another mental disorder. Like, for example, kasi, there are some cases wherein they would feel depressed and at the same time they would feel anxious. So, kailangan mong ma-eliminate is the anxiety caused by the depression, or is the depression or the person or the client is is feeling both depressed and anxious right now. So, yun yung mga kailangan mong i-establish doon. So, what's the clinical description of anxiety disorder or generalized anxiety disorder? So, shift from possible crisis to crisis. So, eto yun. The worry is about these things. Like, for example, iniisip mo, ano na kaya mangyayari sa akin after kong graduate? Tapos, maya-maya, nag-isip ka na yung pagkain namin, parang iba yung lasa kanina. Panis na kaya yun? Diba? So, from that one, kung makikita mo walang general theme or walang specific theme yung worry niya. So, parang kada gagawin niya na lang, usually may worry na siya. And then, ayan, worry about minor everyday concerns like job, family, chores, appointment. So, like for example, ayun nga, hindi ka pa nakakaalis, sabihin mo, baka naman pagdating ko sa office, ang dami na namang problema. Tapos, nasa office ka naman, iisipin mo, okay, ang ulamin namin mamaya, petsa de peligro na, ganyan. So, alam mo yun, yung parang, it's minor, everyday concerns. However, you worry too much about it. So, paano malalaman na it's already worrying too much? So, eto, you're not able to sleep well because of having such thoughts. May clients ako before na sabi niya, minsan 4 a.m. na ako nakakatulog, and then gumigising ako ng 7. So, when I ask the client, bakit di ka nakakatulog kagad? Kasi parang, the client would go to bed around 10 p.m. So, ang aga. Pero, makakatulog siya, 4 a.m. pa. So, kasi iniisip niya daw anong mangyayari bukas, iniisip niya daw yung mga bagay na dapat hindi niya na ginawa kasi nagkaroon ng ganong effect, yung mga ganon. So, lahat yun wini-worry niya. And then, of course, irritability is something that goes with it kasi nga you're stressed about a lot of things, you worry about a lot of things, and sometimes the lack of sleep, it also affects your mood. So, they would not really feel at their best self at that point, kasi nga kung kulang ka sa tulog, hindi ka naman pwedeng very cheery at that time. And then, dahil they tend to worry a lot, it would lead to behaviors like procrastination. They would put doing things off. So, sometimes they would do it last minute. Kasi nga, they tend to worry too much about planning before doing it until such time na wala na pala silang time para magawa yon. Kaya, ayun, nirarush na lang nila and they would do it the last moment. Or they would over-prepare. Like, for example, kuwari may trip ka or may travel ka. Yung mga anxious people or yung mga may generalized anxiety disorder, sometimes they would over-prepare. Like, I had one client na sabi niya nag-away daw silang jowa kasi they had parang ano yata yun, ano ba to, out of town trip, parang overnight trip lang, and then nag-impake daw siya ng maleta, yung 30 kilo na maleta. Sabi ko, why did you do that? What happened? Sabi niya, nag-away kami ng jowa ko kasi nga 30 kilos na maleta ang dala-dala ko. And it was just an overnight trip. And usually when we prepare for an overnight trip, we just have a backpack. Most of the time. Malaki man siya, pero it's just a backpack. Sabi ko, why did you do that? Sabi niya, kasi baka kailanganin namin. Sabi ko, okay, so what are the things that you prepared for that trip? Sabi niya, naglagay daw siya ng parang yung travel iron for the trip, tapos 4 na sapatos, and then parang 5 change of clothes, parang ganon. So, over preparation. Sabi ko, okay, so it's good naman to prepare. However, saan ba kayo pumunta? Kasi sabi niya, baka daw, mabasa, madumihan yung damit niya. So, kailangan niya ng change of clothes. So, sabi niya, parang staycation lang naman daw sila. So, you see how overly prepared the person was. Kung staycation, di ba, hindi naman tayo lumalabas masyado. But this person prepared so much that it caused a problem in the relationship. And then, of course, GAD can be also seen in children. But with children, instead of 4 or the number that we have mentioned earlier, we only need one physical symptom, and usually with kids, napapansin ko they have this physical symptom that they don't feel well, especially concerning their digestive system. Yung sabi nila, masakit daw yung tiyan nila. So, when that's the point, or when that's the complaint, it might be something that has to do with anxiety. Lalo na kung na-clear naman na walang problema medically, it might be due to anxiety. So, usually with children, they worry about their academic, social, or athletic performance. So, there are children like that. I don't have a lot of clients as children, but I did have parang mga I'm sorry, that's a warning signal. I did have friends who would come to me and ask about their children. So yun, napapansin ko nga ito yung mga problems nila. This one. So, more of sometimes academic, or kundi academic, social. So, moving on to the statistics, let's try to see the statistics of the anxiety. So, the prevalence of this disorder is around 3% yearly or annually. So, take note that these statistics are based on US again. However, the rates are similar in other countries. So pretty much it's similar here in the Philippines. In a lifetime, there's a 5.7% that it will happen to you. The onset is insidious. So, bigla na lang siyang mangyayari. Sometimes, hindi, walang, kumbaga, walang manifestation na, magkakaroon ka niyan. So, and it usually happens during the early adulthood stage. The course is chronic. So, if it's not addressed properly or early, it can lead to this particular course. Okay, in the geriatric or the elderly, they usually have anxieties about their failing health or loss. Like, for example, yung mga, syempre pag matanda na, yung mga cohorts mo, usually namamatay na, di ba? Or, you have to retire from your job. So, that is what they worry about most of the time. There is up to 10% prevalence of this disorder happening to this group. And usually they are given tranquilizers, minor tranquilizers in order to address the symptoms. So, kung titingnan natin bakit mas mataas, 17% to about 50%, most of the time kasi it's more or less prescribed for a medical problem or sometimes to really help them sleep. Kasi ang nangyayari kasi at this age is that when we age din kasi the sleep pattern is really affected, but sleep is essential. So to help them with sleep and also help address the medical problems, other medical problems, they are given minor tranquilizers. So the pharmacological part of their intervention is really part of the management. So for this one, they also do that because of the increased risk for falls and cognitive impairments. So for symptom management at para mabawasan tong risk na to, they do that. They give them minor tranquilizers to help with the symptoms. Okay, so what about the causes of GAD? So, of course, again, there is the genetics part or the diathesis. We have an inherited tendency to become anxious. So, if one of your parents are very anxious or very neurotic, as we say nga, it might be you or one of your siblings might have a tendency to have GAD. The level of neuroticism of the person, or in our TOP, this is the tendency to experience more frequent and more intense negative affect and to react with this affect with avoidant coping. So, ayan. Okay, another is they tend to also have people with diagnosed with GAD are seen to be less responsive, and also they have higher threat sensitivity. So ito yung mga konting bagay lang, parang yung reaction nila parang panic na kagad sila. And then with respect to the brain part, ayan, frontal lobe activation. So, nakita nila is that people with GAD have cognitive activity in the left frontal lobe that serves to avoid distressing worry image that would otherwise be activated in the right frontal lobe. So, nakita nila yon sa mga brain scans. Okay. So let's look at it in this visual representation. So a person who has both biological and psychological vulnerability, so stressor due to life events. So this stressor might be possible false alarm, like for example yung commute. So commute is day-to-day stress. Pero yung commute sa kanya na-activate na kagad yung kanyang GAD. So nagkakaroon ng anxious apprehension. So, let's say, for example, magko-commute pa lang siya, pero nag-worry na siya na baka malate siya, tapos pag na-late siya, ang dami na mangyayari. Papagalitan siya, baka mawalan siya ng trabaho, etc., etc. So, nagkakaroon dito ng worry process, a failed attempt to cope and solve the problem. Nagkakaroon din ng intense cognitive processing, inadequate problem-solving skills. And then here we have avoidance imagery, and then of course restricted autonomic response, and this all leads to the generalized anxiety disorder. So kasi ito yung nakikita natin sa worry process when we worry, we tend to overthink. So that's the intense cognitive processing. And then avoidance of imagery, anong nangyayari doon? So you dahil nga masyado kang nag-overthink, hindi mo na nakikita na ano bang pwede kong gawin, right? Or ano bang possible solutions na pwede kong magawa. So ayan, inadequate problem solving skills then. So instead of looking for a faster route, ayan, nag-overthink ka. And then, the imagery na sinasabi natin dito is the problem-solving imagery. At dahil ina-avoid mo yung imagery na yon, ayan, nagkakaroon din tayo ng restricted autonomic response. So, hindi na-activate yung mga bagay na dapat ma-activate para ma-address yung feeling mo na threat. So, these are some of the treatments. Pharmacologically, it is treated with benzodiazepines. Ito yung mga common medications na binibigay. There are, of course, risks about these drugs. However, if it's more beneficial, some of the practitioners would take the risk. Like, for example, with the sleep, minsan kasi mahirap pag hindi na nakakatulog. So, ang inaano talaga nila, hindi, maggamot ka na. So, sometimes we also do that na may mga clients din kasi na ang gusto lang nila is yung psychological intervention. They don't want to take medications. Pero pag ang assessment namin is that they would need to have medication, sinasabi namin na maybe you should see a psychiatrist for prescription kasi hindi yung condition mo or yung situation mo cannot be just managed by psychological interventions alone. So sinasabi kasi rin namin yon. And then sometimes they would also be prescribed by antidepressants. So, antidepressants, of course, this is more of managing the mood. But remember, with anxiety or GAD, sometimes the mood is also affected na because of the constant worrying. Okay. Now, with psychological treatment or psychological management, so, ang nakita nila sa studies nila is that it has similar benefits to drugs but has a better long-term results. Kasi yung mga medications kanina, like for example, the benzodiazepine, hindi siya pwedeng gamitin for long-term kasi studies have shown that it can lead to um, cognitive impairments later on pag matagal kang gumamit ng benzodiazepine. So, uh, kaya ang ginagawa namin is that initial treatment, yung medication, and then pag nandun pa rin yung symptoms, hindi na manage nung drugs, ayan, saka na dun sa ano namin, sa intervention, yung psychological management. So usually the approach is cognitive behavioral. So CBT ang usual na ginagamit ditong approach. And when we try to help out clients with GAD, we use this type of techniques, yung exposure to worry process, and then confronting anxiety-provoking images, and of course coping strategies. Yung exposure to worry process, we usually try to walk them through with how they think about things. Like for example, yung may mga clients ako na isa sa mga worry niya is yung paglabas, especially nitong pandemic, na sobrang worried siya. Even nung nag-ease na yung restrictions, hindi pa rin siya lumalabas. So tinatanong ko siya, do you go out without any protection? Sabi niya, hindi. And then, when you go out, do you go out na as in matagal ka sa labas? Sabi niya, hindi rin. Kung ano lang kailangan ko sa labas. Pag tapos na, bumabalik na ako. So, sabi ko, asan yung worry doon? If you're doing what you can to limit your exposure. So, sabi niya, kasi syempre yung ano, ganyan. So, yun, wino-walk through ko siya doon para mas maintindihan niya na the coping shouldn't be like that, kasi mas more na nire-reinforce niya yung kanyang bad reaction or yung kanyang poor coping method. Ayan. Confronting the anxiety-provoking images. So, yan. Ginagawa din namin yan. We ask them to look at the picture and what the picture, what do they think when they look at the picture, and then ano nang behavior nila. So in-establish muna namin yan in order to help them to deal with these types of or similar images later on in a better manner. Then, of course, coping strategies. We work with them with better coping strategies. Kasi a lot of them would avoid dealing with the problem on hand. Kasi nga, parang sa kanila, it's too much for them. And then, since ina-avoid nila yon, they ruminate on what would happen or ano yung bad consequences. So, doon sila nagro-ruminate. Yun yung nagiging coping nila, which is not a good coping strategy. And then, acceptance and meditation. Anong acceptance? Personally, with my clients, I try to help them out with asking them, do they know what are the things that they can control and they cannot control? So, like for example, yung mga nagwo-worry lagi sa kanilang performance sa work. Kasi nga, parang, lagi kasi akong late, ang traffic, ganito, ganyan. So, they look at the situation in a very helpless manner na parang wala nang mangyayari. Na parang, the commute is beyond their control. So, I ask them to look at it in a different way. Ano yung makokontrol niya at hindi niya makokontrol in that particular situation. So, para lang makita niya na you have control, hindi nga lang yung control na gusto mong mangyari, but you still have control over the matter. You just have to look at it in a different manner. So, ganun namin siya ini-establish. And of course, meditation. So, sometimes when we tend to be overwhelmed with a lot of things na nakalilimutan natin to take a breather. So, we usually encourage or I ask my clients to have some form of meditation, especially when things seem too much. Um, so, minsan sasabihin ko sa kanila, if masyado ng overwhelming lahat sa'yo, try to have a walk outside of your house, yung mga ganon. Or, kung medyo spiritual siya or religious siya, ayun, sabihin ko, punta ka muna ng simbahan if that's where you find your peace. So, dun ka muna. And then, pag medyo ayos na ulit, hindi ka na ganun ka-stress, balik ka na ulit sa ginagawa mo. Para lang ma-shift yung focus niya. And then, hindi siya masyado ma-feel overwhelmed. Okay? So, next up, we have the panic disorder naman. So, panic disorder, so we have the clinical description here, of course. So, these are unexpected panic attacks. Anxiety, worry, or fear of another attack is also prevalent. So, usually, it persists for a month or more. There are cases na panic disorder lang ang meron sila, and there are cases na panic disorder and agoraphobia. So, dati nun ang description niya, panic disorder with or without agoraphobia. May ganun siyang diagnosis. So, ang agoraphobia naman, this is fear or avoidance of situations or events. So, this is more of a concern being unable to escape or get help in the event of the panic symptom or other unpleasant physical symptoms like incontinence, vomiting, or falling. So, what's the clinical description of this one? So, the avoidance can be persistent to the point na yan, may agoraphobia ka na. By the way, agoraphobia means literally fear of the marketplace. The agora is the marketplace. Phobia is the fear of. So, because of the panic disorder, ayan, ina-avoid mo na yung mga social situations or going out because of the fear that you might have another panic attack next time. So, the use and abuse of drugs is also there. This is for them to cope with the symptoms. So, ginagawa nila yan at times. And then, meron tayong tinatawag na interoceptive avoidance or avoiding activities that might feel or that might bring on the physical sensation similar to panic. So, like for example, exercising, di ba? Syempre, pag nag-exercise tayo, our heart rate is going up. So, it's something similar to palpitation. Or having sex is also something that they try to avoid. Having caffeine or pati anger, ina-avoid nila yon. Pati yung amusement park, like for example, roller coaster, or yung haunted house na attraction sa theme park or sa amusement park, ina-avoid nila yon para lang hindi nila ma-feel yung similar physical symptoms na yon. Okay, so statistics-wise, in a year, there is a prevalence of 2.7. In lifetime, there is an incidence of 4.7. So, usually, it's more diagnosable with female than males. So, for every 2 females, there's 1 male with panic disorder and agoraphobia. So, the onset for this one is acute, and this is more common in young adults around ages 20 to 24. Okay, with special population. So, ayan. By the way, to give you an idea, kaya siya tinawag na special population kasi a lot of the the prototype or the diagnostic criteria that we have in the DSM is based on adults. So, adult population yon commonly. Kaya tinatawag na special population ang children and elderly. Dahil iba rin ang symptoms nila when it comes to these disorders. So, with children, hyperventilation is a common symptom. Again, iba yung physical manifestation ng kanilang panic kesa sa mga adults. There is also, we can also see earlier cognitive development. Since they are in the earlier cognitive development, there are fewer cognitive symptoms. So, kaya it might be tricky to detect this with them kasi nga, nagde-develop pa rin ang kanilang cognition. So, hindi pa nila mafe-feel masyado yung parang feeling ko mamamatay na ako. Wala pa silang ganun kasi nga they are still in the age na nagde-develop pa yung brain nila. So, this type of symptoms are fewer or lesser ang manifestation sa kanila. With the special population na adults, mga seniors or elderly, so the health focus is more common with them. Ito yung mga common worry nila or yung attack na tinitingnan nila. With the prevalence na kaninang sinabi natin, it tends to decrease with age. So, bumababa yung possibility na magkaroon sila nito as they age. Okay, so what are the diagnostic criteria for panic attacks? So, meron tayong recurrent, unexpected panic attacks. So, sorry for the typo. At least one attack has been followed by significant worry or maladaptive change in behavior. There is no attributable substance use or abuse. Again, it's not due to drugs and not better explained by another mental health disorder. So, like for example, autism, it's not because of autism kaya siya may panic disorder. Remember, may mga may autism na kung titingnan mo, the symptoms are quite similar with panic disorder. Okay, next. Agoraphobia diagnostic criteria: mark fear or anxiety for 2 or more situations. So, public transportation, open spaces and closed spaces, standing in line, being outside of the home alone. So, public transportation, like for example, riding the jeep, bus, or ano ba to? MRT, LRT. Open spaces, like going to the parks, and closed spaces, ayan, yung mga parking lots, elevators, yung parang you feel suffocated, and then minsan pag nakapila din, na feel din nila yan. And then also when they go out by themselves. So, usually, people with agoraphobia try to avoid these types of situations. So, as much as they can, they try to avoid public transportation. I have a client like that before. Lagi siyang nag-grab. Okay? Okay sana si Grab, pero ang problema, yung sweldo niya, hindi na, parang sumisweldo na lang siya para may pang-grab siya. So, dahil nga dito, natatakot daw siya sa public transport kasi baka madukutan siya or baka may biglang manaksak sa kanya. So, may mga garong worry siya. And then, the situations always provoke fear. Kahit iniisip niya pa lang, natatakot na siya. And the anxiety is not proportional to real danger. Like, for example nga, yung client ko, iniisip niya pa lang na sasakay ng jeep or sasakay ng bus or MRT, iba na talaga yung pakiramdam niya. Parang feeling niya daw talaga mamamatay siya pag sumakay siya doon. And it causes significant distress. Okay? So, sa kanya, although the client wants to be, or wants to learn how to commute better, kasi nga, hindi practical yung ginagawa niyang Grab everyday. Um, Hindi niya pa rin kayang gawin yon because of the avoidance. Ito nga kasi coping niya, ina-avoid niya yan. And then, the anxiety is excessive. Just thinking about it was already making the client feel really bad. And, of course, not better explained by another mental health condition. Okay. So, about 75% of those with agoraphobia are female. So, these are, let's talk about this disorder with regards to gender and culture. So, bakit? Kasi, as we know in every society, a lot of the victims of, mugging, robbery sa labas, 'di ba? Ano pa? Yung sexual harassment, those things, all of those are mostly female. Kaya, ang usual na nagre-report nito ay mga babae. Kasi nga, they are the ones who are seen to be susceptible to these types of crime. Diba? So, in terms of culture, actually, there's no difference. According to the statistics, there are similar prevalence rates across culture. However, there are some variable symptom expression, like for example, somatic symptoms are more emphasized than emotional symptoms in developing countries. So, hindi sila nakatingin doon sa mood per se, anong nararamdaman mo. It's more on ano yung physical symptoms mo. Yun yung mas tinitingnan nila. And in countries like America, they look more with the panic or the physical symptoms of panic rather than the emotional state. Okay. Now, we also have the culture-bound syndromes. Ito yung parang agoraphobia, but in countries, they call it, in specific countries, they call it like this. Like, for example, susto. Okay? So, saang country yan? Hopefully, nakita nyo sa libro. We also have atake de nervios. Okay? And kyolgyu. Hopefully, I didn't butcher the pronunciation. This is another culture-bound condition na has something to do or similar to agoraphobia. We also have that one, although it's not listed or it's not that well studied. We have the concept of nervyos, diba? Ninenervyos ka na naman. Or napaka-nervyosa mo, diba? Yung mga ganung thinking sa atin. And then this is a specific condition. We call it the nocturnal panic, wherein 60% of people with panic disorder usually experience nocturnal attacks. So the nocturnal attacks usually occur in the non-REM sleep. But if you would look at their the stage of their sleep, it's around the delta or the slow wave sleep. Parang papunta na doon sa REM, but not REM. So this is usually caused by deep relaxation when sensations of letting go are anxiety-provoking to people with panic attack. So when they are asked na, let go mo na lang, so parang hindi nila, dahil pag matutulog, minsan sasabihin, don't think about it. So most of the time, that would happen to them. And then we also have the sleep terrors. Now, the sleep terrors, this is the childhood condition of intense fear in the middle of the night. So, ito yung minsan yung bigla na lang sisigaw yung bata, tapos lalabas, yung parang bigla sila na panic in the middle of their dream, or not dream, in the middle of their sleep. Tapos pag tinanong mo bakit, hindi nila masabi kung bakit. And then the following day, pag tinanong mo, naalala mo, umiyak ka kagabi, tapos sumigaw ka nga, ganyan. Hindi na nila maalala yon. And then, sometimes, there are isolated sleep paralysis. Ito yung temporarily unable to move when transitioning from sleep to wake, accompanied by surge of terror and occasional hallucinations. So, ito yung parang, ano ba to? Yun, kasi nga parang nagpapanik yung tao once they have this type of, or once they are in this particular situation. Sometimes they are not able to move part of their body, or they are not able to move at all. So, mas lalo silang nagpapanik, and they sometimes would report seeing things. So, we look at it as isolated sleep paralysis. Yung sasabihin nila, may nakatayo sa dibdib ko na parang demonyo, yung mga ganon. So, again, that's it. Okay, so what are the causes of nocturnal panic? So, we have a generalized biological vulnerability, so alarm reaction to stress, and cues associated with situation, like for example, conditioning. So, pag naiisip mo bago ka matulog, or pag naging ganun na nga, or pag naging condition reaction mo na nga, so likely mangyari siya ulit. And then anxiety about future attacks, it can be also caused by that. And then hypervigilance, yung tipong hanggang sa pagtulog mo anxious ka pa rin. And of course, increase in interoceptive awareness. Okay, so let's look at it in this diagram. So, yan, parehong may ganyan. So, stressor, here is the stressor of the event. False alarm associated with somatic sensation. Okay, like for example, sumakay ng sasakyan, learned alarm. Specific psychological vulnerability, unexplained physical sensations are dangerous. So, yan. Anxious apprehension, focus on somatic somatic sensation, sorry. So, it can move to here. Development of agoraphobia. Yan. So, pag napunta na siya dito, ayan. The disorder is panic disorder and agoraphobia. Pero pag hanggang dito lang siya, or dito siya pumunta, dire-diretso, panic disorder siya. Okay. Okay, medications. Usually, these systems are affected by the medications that will be given for panic attacks. The serotonergic system, noradrenergic system, and the GABA system. So, all of this, if you would look carefully, ano yung mga yan, it has something to do with the alarm response. So, kaya yun yung mga tinitira or focus ng medication na binibigay. So, usually, people with panic disorders are given benzodiazepines, particularly Ativan, and then SSRIs. Itong Prozac, maybe you have heard this one. However, the problem with just the medication is that mataas yung relapse rate after they stop with the medication. Ito actually isa sa mga naging problema ko, kasi a lot of my clients, so actually sumakit ang ulo ko dito before, Pag tinatanong ko, sabi nila, meron na po akong medication dyan dati kasi ganto-ganto, binigay po ng doktor ko. So, kumbaga, na-diagnose na siya with panic disorder before and was given treatment or management for it. However, siya yung nag-decide na i-discontinue. So, pag tinatanong ko sila, were you advised by your doctor to stop the medication na? Kasi nga, again, remember with some of the benzodiazepines, pag matagal yung gamit niya, may side effects talaga na hindi mo gusto. So, pag tinatanong ko sila, sasabihin nila, ayun, most of them would answer, no, ako na nag-decide kasi okay na ako. So, medyo nawawalan ako ng pasensya pag gano'n. So, sinasabi ko sa kanila, the discontinuation of your medication should also be advised by your doctor. Kasi nga, since sila ay nakakaalam nung chemical components nung gamot, they would be also be knowledgeable kung ano nang pwedeng gawin. Papatan ba natin yan? Bababaan na lang natin ng dosage or stop na natin altogether? Kasi pag pupunta naman sa amin, sabihin na, nagpapanik ako, di ko alam kung anong gagawin, blah, 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 blah. So, same symptoms na yun pala, kaya lang bumalik, it's because they stopped their medication. So, yun yung problema doon. Okay. With psychological interventions, ayan, usually we try exposure-based, especially pag may agoraphobia. So, may client ako nun dati na, sabi ko sa kanya, why don't you try just stepping out of the house? Kung hindi ka pa makasakay, maglakad-lakad ka muna. So, just to see. Sabi ko, observe mo muna ano yung ginagawa ng mga taong nagko-commute. So, reality testing then, I also ask my client what would happen if they just stay at home. Ayun, sa panic treatment naman, or specifically may panic disorder lang, I ask them to do this one, relaxation and breathing skills. Kasi nga nangyayari, when the panic attack happens, they are all focused na with the panic or the symptoms of panic, especially the cognitive symptoms na they might die, they might lose control. So, dun talaga sila nakafocus. So, ang sinasabi ko sa kanila, whenever you feel na yan na siya, papunta na siya, do the relaxation and breathing skills first. Para hindi siya, kasi nga a lot of them would say na they felt overwhelmed when the panic happens. Okay, and then another would be, ayan, panic control treatment, exposure to interoceptive cues. So, ayan, either exercise or yung mga theme park rides. So, pinupuntahan muna namin yon, or I ask them to go there to see. Cognitive therapy, yan, we try to address ano ba yung thinking nila tungkol doon and try to ask them to reframe that kind of thinking. And then, of course, the relaxation and breathing techniques. So, this type of intervention actually has higher rates of efficacy. So, that's why, me personally, I would combine it with medication. Kasi, again, there are cases na hindi talaga kinakaya ng psychological intervention lang. Okay. So, combined psychological and drug treatments, ayan, no better than CBT or drugs alone. However, CBT is better for long term. So, ito nga yung sinasabi ko kanina na once they are deemed to be okay to go about without the medication, ayan, CBT na yung long term nila. So, pinag-uusapan din namin yan ng client. Okay, so I hope you're still there. You can pause the recorded discussion if you want to stand a bit and also have some water break or bathroom break. So, nandito pa rin naman ako pagka-play nyo. Okay? Okay, we move on now to specific phobias. Okay? Now, phobias are, ito yung alam natin, yung in layman's term, di ba? Parang, may phobia ka ba sa ganun, di ba? We ask this type of questions whenever we hear someone being very fearful about something na hindi naman dapat katakutan, right? So, like for example, high places, riding an elevator, ano pa ba? Spiders. So, those are things na parang, teka lang, parang masyadong extreme or masyadong OA naman yung fear niya. So, diba, we have this kind of thinking. Not knowing that the person might have this type of diagnosis, which is what we call the specific phobia. So, the feared situation usually for this particular disorder almost always provokes anxiety. So, I have one of my cousins before. She developed claustrophobia, so fear of enclosed spaces. So, the thought of just coming or getting into an elevator na ano na siya, napapawisan na siya ng malabot. So, ganun yung sa kanya. And we're just going to ride the elevator. Usually, we only ride the elevator for a few minutes, right? Nung tinanong ko siya about that, I think I was still in college when we talk about it. Sabi niya sa akin, kasi parang feeling niya daw, parang isa-sandwich daw siya sa loob nung elevator. Kahit be it na siya lang mag-isa or may kasama siya, feeling niya parang lalamunin siya ng elevator. So, ganun yung idea niya about it. So, it causes significant impairment or distress as well. So, like the other disorders that were mentioned. So, in her case, dahil nga sa sobrang takot niya or dahil sa phobia niya sa elevator, sometimes there are instances wherein she would rather take the stairs than ride the elevator, na mas convenient and mas efficient way to get around inside a building or inside a structure, diba? So you can just imagine kung mare pupunta ka ng 15th floor or minsan 5th floor pa nga lang, diba? Hingal na hingal ka na. Pero sa kanya, hindi, mag-aano na lang ako, maghahagdan na lang ako para dito. So, ganun yung ginagawa niya minsan. So, that's why there are times na late siya sa trabaho niya or sa mga meetings niya dahil nga imbis na mag-elevator, naghahagdan siya. So, bakit walang picture to? Okay. Let's have a watch
whether
first.
they like to admit it or not, has fears and gets anxious about certain things. Whether it be a spider crawling on the ground or getting up in front of large groups of people. In most cases, though, people cope with those fears and confront them. A phobia is the most extreme type of fear, where it actually causes them to go to great lengths to avoid being exposed to the feared or perceived danger, even if there's no actual risk or danger, and people often feel powerless against it. Phobias are considered the most common psychiatric disorder, affecting almost 10% of the population. Phobias are extreme, often unreasonable and irrational fears of something, which could literally be anything, like pyrophobia, fear of fire, electorophobia, fear of chickens, triskaidekaphobia, fear of the number 13, phobophobia, fear of developing phobias, or even panicophobia, a fear of lists. Unreasonable or irrational fears get in the way of daily routines, work, and relationships because patients with phobias might try to do whatever they can to avoid the anxiety and terrifying feelings associated with the phobia. For example, most people don't necessarily enjoy the company of a spider, but they also don't let it affect their social or daily life. Like, even though I know there are spiders in the woods, I wouldn't avoid a camping trip on account of the spiders. Even if they love camping, somebody with arachnophobia, a fear of spiders, might refuse to go because they know there's a possibility of seeing a spider in close quarters. The fear is clearly interfering with their social life and relationship with friends, meaning it's a phobia. An irrational fear of an object or situation like this is called a specific phobia. The Diagnostic and Statistical Manual for Mental Disorders, edition 5, splits these specific phobias into 5 categories. Fear of animals, like arachnophobia or electorophobia. Fear of the natural environment, like darkness or nyctophobia. Fear of blood and needles, hemophobia. Situational fears, like fear of flying, aviophobia. And then other fears, like fear of clowns, coulrophobia. These specific phobias are one of 3 main types of phobias. The other 2 types are agoraphobia and social phobia. Agoraphobia means fear of public places, but has to do with being fearful in a public space where it feels like it might be hard to escape quickly and return to a place perceived as safe, like the person's home. Therefore, people with agoraphobia tend not to venture out very often. Some commonly feared areas might be places like crowded shopping malls or theaters, where it might be difficult to escape quickly. Social phobias, on the other hand, are overwhelming and persistent fears of social situations and interactions. People with social phobias are fearful of being embarrassed or judged by others. Being embarrassed or feeling awkward in a social interaction from time to time is totally normal. But people with social phobias often feel anxiety for weeks leading up to events before they happen, and are afraid of doing common things in front of others. For example, someone with a social phobia might be afraid to eat in front of someone else. For people with phobias, seeing, being exposed to, or even thinking about the phobia causes severe anxiety that's often not proportionate to the real threat. They'll catastrophize and jump to the worst case scenario and think that it's more likely to happen than it actually is. These thoughts can lead to physical symptoms like excessive sweating, trembling, and an increased heart rate. That being said, it's important to reiterate the difference between an everyday fear and a phobia. Feeling queasy while you're climbing a ladder would be an everyday fear. Avoiding your favorite frozen yogurt place because it's on the 2nd floor of a building would be a phobia. Feeling weirded out around your best friend's pet snake is an everyday fear. Avoiding your friend's house entirely because they have a snake would be a phobia. Unless it's not in a terrarium and slithering around the house, then I guess it would be an everyday fear. Basically, it comes down to the idea of what would be an appropriate or reasonable response versus a disproportionate or exaggerated response. But what causes a phobia? Well, we don't really know, but we do know that you're more likely to develop one if you have a family member with a phobia. Sometimes, though, phobias might be caused by specific traumatic events, like being confronted by an aggressive raccoon. Now, tailoring treatment for a specific individual's fear is super important in effective therapy, because different patients might respond differently depending on the therapy, especially if other conditions are involved, like depression and drug abuse. Psychotherapy, particularly cognitive behavior therapy, can be super beneficial for patients. Cognitive behavior therapy teaches patients to be mindful that their fear is irrational, and the likelihood of their worst fears coming true, like being attacked by a pack of angry raccoons and getting rabies and dying an unpleasant, untimely death, is actually very low. Also, systematic desensitization might be used, where a person is gradually and systematically exposed to the feared objects. Patients first learn to identify the anxiety, then they learn coping techniques, and last they use their learned coping techniques to overcome situations. The vast majority of patients can be treated using these tailored methods.
So hopefully you are able to hear the audio. If there's a problem with this particular video, I will be posting the link as well in our TBL Hub. So as mentioned earlier, so this is the diagnostic criteria for phobia, specific phobia. So it can be regarding a specific object or situation. So like for example, animals or and a situation like the typhoon. And then the reaction is this, almost always provokes immediate fear or anxiety. So kahit na parang yun pa lang, parang pinag-uusapan nyo pa lang yung tungkol sa gagamba, tapos meron siyang arachnophobia, so definitely you will be seeing um, physical or as well as cognitive changes in the person um, who has a phobia on that specific object. So the phobic object or situation is actively avoided. So just like what I told you earlier about my cousin, she would rather take the stairs than take the elevator because that and she doesn't really want to ride the elevator. The phobic object or situation is out of proportion to actual danger. So ayun din, si it would really be impossible for her to be uh, sandwiched inside inside an elevator, but she feels that the elevator could do that to her, and this usually lasts for more than 6 months. So with regards to my cousin, she used to have that even when she was in college, and then it lasted when she started working as an engineer, 'di ba? So um nakita mo talagang irrational kasi 'di ba, like for example, for engineers, they have to be on site um to check yung structure ng mga buildings, right? So how could you go from floor to floor if you're not going to take the elevator? And then it causes clinically significant distress. So like for instance, in her case, it causes her to be unable to really perform well in her tasks in her job. And of course, it shouldn't be explained by symptoms of another mental disorder. Now, this one is a very specific phobia. This is the blood injection injury type phobia. This is what we saw in Judy's case in the first chapter. Ito yung sa kanya. So, we're in nagkakaroon ng somatic symptoms or physical symptoms like decreased heart rate and blood pressure when seeing blood injections or injury. And then there is also fainting and inherited vasovagal response. So usually it takes place in childhood or nade-develop siya during the childhood stage. Next up, we have the situational phobia. So yan, a fear of flying, driving, for specific situations. Yung dati kong kasama sa work, ano naman siya, ayaw niya sumasakay ng bangka. So yun, may mga business trip kami na to get around, the only way to get to the other place would be to ride a boat. So talagang ano siya noon, hindi siya sumama sa amin nun. Kahit na siya yung mag-interview dapat ng client, she didn't come with us because she's really afraid of riding boats. So with the situational phobia, of course, it's not an unexpected panic attack or uncued panic attack. So may cue ka kasi, katulad dun sa kanya, alam niyang sasakay siya ng bangka, ayun, na-trigger na yung symptoms niya. So the fear centers around the risk of the situation. Sa kanya kasi ang iniisip niya, baka lumubog yung bangka, tapos hindi siya marunong siya lumangoy actually, pero kasi she doesn't feel that she will be able to swim for survival. Yun yung iniisip niya in that particular situation. So so the panic that she felt here is not due to the panic attack, but rather it's more due because of the situation itself. Na yun, baka lumubog yung bangka, baka actually kahit yung mga malalaking bangka, yung mga parang 20 katao ang kayang isakay, ayaw niya pa rin sumakay doon. And even sound na barko, ayaw niya din. Iniisip niya daw kasi baka maging Titanic ang kakalabasan. So, usually the onset of this one is early to mid-20s. So, madalas siyang detect around that time. Or nire-report around that time. And then we also have the natural environment phobia. So, wherein there is a fear of either heights, storms, and water. So, they may be clustered together, and it's usually associated with real dangers. Like for example, sa storms, di ba? So, especially with a storm, yung mga lugar na laging binabagyo. So, usually, makakita ka na may mga ganyan na phobia doon. I know there were a lot, or parang nag-increase ang incidence nito in the Visayan region after the Typhoon Yolanda. Yung parang konting bagyo lang, umano na sila. And also here in Manila, if you remember Ondoy, I had friends before na mga taga Marikina, kasi lumubog yung Marikina nun if you would remember at that time. So parang after that particular typhoon, every time that it would rain heavily, kahit walang typhoon signal, natatakot na siya. And then nagpapanik na siya. Lahat na ng pwede niyang gawin, ginagawa niya na. So, among the disorders, ito yung talagang parang tangible yung threat. Okay. And then we also have animal phobia. So, animal phobia, fear of dogs, snakes, mice, insects, so kung ano pa. So, it might be associated with real danger. So, like for example, yung mga takot sa bee or sa mga wasp, this is because although their sting is typically parang non-poisonous, or hindi naman, kumbaga parang hindi naman tayo naapektuhan masyado ng sting nila, but there are people who develop parang allergic reaction doon sa sting nila. So they might die of the anaphylactic shock, not the sting itself, but the allergic reaction caused by the sting. So yun yung kinakatakot nila. And then just like with the others, the onset is usually in childhood. Now, statistically, the prevalence of this disorder is around 12%, and in a lifetime. Okay, annually there are 8.7% reported cases, and then ratio of the incidence for female and male is about 4 to 1. So I'm not sure if it's underreported with males due to cultural values and such, but mostly it's the females who would report having this type of disorder. The course of this one is chronic, and onset, as have mentioned earlier, is during the childhood stage. Now, what's the causes of the phobia? So, the direct experience of the situation itself can be a cause of phobia. So, like for example nga, yung mga naka-experience ng mga matitinding bagyo. So, a lot of, again, yung katulad yan sa Typhoon Yolanda, there was a reported increase of the phobic reaction towards strong gusts of wind, as well as strong rainfall or heavy rainfall, because of the experience with the typhoon Ondoy, not Yolanda, sorry. Yeah. Ondoy and Yolanda. So for Manila, it's more on Ondoy, and then Yolanda for the Visayan region. Or it can be due to vicarious experience. So seeing someone else encountered a feared object. So my brother is like that. He's afraid of spiders. Even yung mga gagambang talon sa bahay, takot na takot siya. Eh, he's a big guy. Malaking lalaki yung kapatid ko. Actually, he's much bigger than than our dad. So, pero kasi may napanood siyang parang, I think it's a documentary or whatnot, na there was a big spider, parang documentary yata siya sa Australia, because in Australia they have like big spiders, and then the spider jumped on the person's face. Yun, tapos parang natakot na siya doon. So I don't know what to do with that one. So that's a vicarious experience. Then we also have information transmission, learning about a situation or object being dangerous. So like for example, yung ayun, yung friend ko na yung dati kong ka-work na ayaw sumakay sa bangka. She learned it only from her mother. Sabi nung nanay niya, wag kang sasakay ng bangka kasi baka lumubog. So yun yung sabi ng nanay niya. Parang na-experience yata ng nanay niya dati na sumakay. Parang tawid ilog lang yata. And then the boat that her mom rode had some holes in it. Pero nakarating naman sa kabilang parte ng ilog. Pero parang after that experience, sinabihan niya nga tong katrabaho ko dati na wag kang sasakay ng bangka kasi it's dangerous. So, that's information transmission. And then, of course, we also have preparedness or air quotes, preparedness na parang instead na malagay ka sa alanganin, wag na lang. So, they, like for example, yung mga, ano ba to? Yung fear natin towards specific animals, like for example, snakes, 'di ba? So it's more of a preparedness that we got from our ancestors, kasi nga parang kung ito-trace back sa DNA when they were before yung mga prehistoric times, definitely it's the survival of the fetus. So they really haven't learned to adapt with their environment at the time. Pero nakita nila that one of the most dangerous animals around them are the snakes because of their venom. Alright. So this is another diagram of the cause of phobia. So we can see, ayan, pwede ka kasing magkaroon ng biological vulnerability. Ito nga yung tendency to be prepared. Or pwede meron kang low threshold for specific defensive reaction. Yan. So, like for example, nakita lang ng dugo, parang nahihilo na or hihimatayin na, parang gano'n. So, also, it can be a direct experience. Okay, so like for example, itong stressor mo is parang sumakay ka ng elevator tapos na-stuck ka, so kala mo hindi ka na makakaalis doon. So that's a direct experience. So true alarm, then learned alarm. So parang from there, you have associated elevators as a danger or a threat to yourself. Or vicarious experience, you saw someone have that kind of, or had a bad experience with something. Like for example, hinabol ng aso, nakagat ng aso, pero hindi naman ikaw yon, pero nakita mo hinabol siya ng aso tapos nakagat ng aso, so nagkaroon ka na rin ng phobia with dogs because of that seeing or witnessing that particular scenario. So from that, it can, yan, through alarm, learned alarm to generalized psychological vulnerability. So nagkakaroon ka na ng anxious apprehension, focus on future contact with phobic object or system. So ito na yung specific phobia. Okay, so as for treatment of phobia, we have the following. So we can do cognitive behavior therapies. So as you have, or as you might have noticed, a lot of anxiety disorders are treated with CBT, and this is because the behavior, the problematic behavior that we're seeing or kailangan i-address are the result of how they perceive or they frame the situation to be. So kailangan ayusin muna yung perception nila, or how they see the situation, in order to have a better action or a better response to that particular stimulus. And we also have the exposure, so either graduated or structured exposure. So the two are systematically, or it was planned out for systematic progression through the hierarchy of feared situations. So like for example, someone who would be fearing spiders would first look at the picture of the spider, then watch videos of the spider. Pag okay na siya sa picture, videos naman. Then, ilalagay na siya sa room with a spider, pero nakakulong yung spider. Tapos, ayan, unti-unti niya nang i-approach yung spider. And then, hanggang sa itatouch niya na yung spider and see that there's really nothing to fear around the spider. So, it is this particular exposure, both of these two are done until the anxiety symptoms are lessened, or the signs of anxiety are lessened. So ganun siya ginagawa. And then relaxation, dati talagang part siya ng treatment, pero in terms of the studies, hindi na kasi siya empirically supported. Wala na to masyadong studies. Kaya, although it's part of the practice pa din, hindi na siya, kumbaga, hindi na siya masyadong nare-recognize as part of management. Alright, next up, we have separation anxiety disorder. Now, the separation anxiety disorder, before, it is only limited to children. So, take note of that. So, I think that's in the SM4 TR, wherein it's only, kasi, the statistics or the studies before shows that a lot of children has this, but later on nakita nila na pwede rin kasi siya sa adults. Meron rin ng mga adults nito. So it's only with the DSM-5 siya napaltan, so pwede na siyang i-diagnose sa mga adults. So anong clinical description niya? Characterized by unrealistic and persistent worry that something will happen to self or loved ones when apart, like kidnapping or accident, as well as anxiety about leaving loved ones. So about 4.1% of children meet the criteria, while it's 6.6% for adults. So kaya nga nilagay na rin to sa adults, or pwede mo na rin tong i-diagnose with adults, kasi looking at the prevalence, mas mataas pala statistics niya sa adults kaysa sa mga bata. So um just a distinction between the two. Sa parents kasi, or sa adults, it's not about being separated with the children. The separation anxiety happens with their pathological worry that something might happen with their children. Like, for example, madalas natin ito makita doon sa mga overly strict parents na parang kaya ako hindi pinapayagan, baka kasi anong mangyari pag nasa labas siya, yung mga ganun. So, ayan, baka manakawan, or baka maaksidente sa labas, yung mga ganun. Kasi nga, they are not with their children outside. So, the problem with this one is, since pinaltan nga siya at nilagay na rin siya, or sinabi na rin na pwedeng magkaroon ng ganyan din ang mga adults, sometimes it's missed out, and minsan na ilalagay na for adults it's GAD instead of SAD. Okay? Okay, and then another one, we have the social anxiety disorder, or the social phobia. Now, the social phobia naman, these are the extreme or irrational concern about being negatively evaluated by other people. So sometimes it's not plural. Kahit isang tao lang, may ganun pa rin concern for this particular phobia. So, and sometimes it's manifested as shyness, but not always, again, kasi ang daming nako-confuse with this particular phobia with introvertness, or being introverted, as well as shyness. So being introverted does not mean you have social phobia. You're not just fond of being around a lot of people, or you would prefer to spend more time by yourself than with other people. And the same with shyness. Na shyness kasi it's more of a personality, na mahihain ka, and not because mahihain ka lang talaga. Hindi dahil parang ayaw mong ma-judge ng ibang tao. Mahihain ka lang talaga. Ito, akala nila mahiyain, pero may social phobia pala. Okay?
To call your contacts, I need your mobile number. Go to the Alexa
Okay.
app to verify
Now,
your phone
it
number.
leads to a specific impairment or distress, of course, because some of the people with social phobia, especially mga estudyante, they would not report in front of the class, or even when they are asked to recite in the class, they would not do it. I had a student like that before, kasi nga pinatawag ko lang dahil kasi siya na lang yata yung hindi nagsasalita sa buong klase ko. Parang nung tinignan ko yung record ko, lahat na nakapagsalita, siya na lang hindi. Hindi pa siya nakapagsalita, namumutla na siya, and then bigla na siyang umiyak, tapos umalis ng classroom. So, from that very irrational behavior, I can say safely that that student has social phobia. So, or sometimes, ayan, hindi na lang sila papasok, or they would endure the situation with extreme distress. So, there are specific subtypes. So, ano yung mga subtypes na yon? Pag sinabi mong subtype, parang specifier siya, or the symptoms happen only in that particular situation. So, katulad nito, we have performance only. So, you have to also note that pag magda-diagnose ka. Kasi baka mamaya, ang pagkakaintindi is that in all situations or social situations na nagkakaroon siya ng phobic reaction. remember, how you diagnose will also matter with how you plan the intervention or case management. So, for performance only subtype, the anxiety is only when the person is in a performance situation. Like, let's say for example, ayan, performance or public speaking, ayan, magre-report siya, so dun niya lang siya nararanasan. But in other situations, like speaking in a small group, hindi naman, or um, social interaction with other people, hindi rin naman. Now, for social and anxiety disorder, the statistics are the following. So, we have the prevalence of this one is about 12% in a lifetime, and yearly there is an incidence around 6.8%. So, if you would see the female to male ratio, it's the same, and usually it starts around the age of adolescence. And as per the statistics, ang nakikita nila is that it's common with people who are about 8 to 29 years old, and usually they have or they belong in the lower level of education, um, also single, as well as they belong in the lower or low socioeconomic strata. So, the prevalence of this one, kung i-compare natin sa age, it's around 13% or 14% from 18 years old to 29 years old. And then, it's also prevalent with the geriatric or the elderly at 6.6%. So, sa kanila naman, it's more on, ayun, they have social phobia because of the, again, health concerns. Kasi nga, that's the time that they would experience incontinence, yung mga ganon, ano pa ba, yung the eating habits that are affected by their age. So, yung mga ganong concerns in particular. Okay. Okay. So, in Japan, we have this similar condition called Taijin Kyofusho. Okay? So, the Taijin Kyofusho concept in Japan, it's the fear of offending others or making them uncomfortable. So, they are also, this is also about the concern about the personal appearance, like for example, stuttering, blushing, or even body odor. They care about this. So, instead of being worried so much about these things, they would rather not interact with other people. So, ayan. Now, what about the causes? Okay. So, with the generalized psychological vulnerability, so there, like for example, you have these beliefs na, ayun, I cannot please everyone. Diba? Which is true naman. However, the problem with this type of belief is that just like how we prepare for dangerous animals, we also prepare towards we also prepare ourselves to fear, angry, or rejecting people. So, parang basically that's how we react about it. Okay. Whereas with the generalized biological vulnerability, it's more of the propensity towards anxiety. So the person has more of yung tendency niya. Ayun, parang kumbaga ang genes niya talaga is more a warrior than a person who's just chill or relax. Okay. Now, for medications, ito usually ang ginagawa. So, nakita nyo ulit yung mga familiar things or familiar medications like benzo. Zoloft is also a familiar medication as well as Paxil. The other one, actually, to be honest, I'm not familiar with this one. This is our more specific medications. Okay. Now, with beta blockers, ito yung mas ginagamit ng mga performers, like for example, musicians. I have one particular, si Kian Palsa. Sorry ha, mga Korean ang alam kong celebrity. Korean 84. He's an artist and then parang celebrity of sorts in South Korea. So, I think he takes this one, yung beta blockers. Kasi nga, parang celebrity siya. So, pag-attend siya minsan ng award shows, di ba maraming tao yun. So, umiinom muna siya ng gamot bago siya pumunta doon. Or even, kahit nasa taping siya, umiinom din muna siya nun. I'm not sure kung ginagawa niya pa rin yun or hindi na. Pero, in the past shows that he had, he was very open about that particular situation. So the beta blockers are used for these types of people to combat stage fright, whereas benzo are more prescribed for performance only social anxiety. And then yung SSRIs, pag naman siya, more on generalized social anxiety, like may pag-usap lang sa mga yun, kumari katrabaho niya, classmate niya, so more or less SSRIs yung binibigay sa kanya. And then the cycloserine, ito naman yung antibiotic for tuberculosis actually, but it is seen as a cognitive enhancer that improves extinction learning. So, yan. Pinibigay din nila yan para ma-improve yung ability to cope with feared situations. Okay. So, this is just a figure or this is a table to see ano ba ang efficacy ng placebo, ng Prozac, and cognitive therapy in terms of yung SE, by the way, is a self-exposure. So placebo plus self-exposure, so kung makikita natin, so they did it during a 12-month period. So the baseline before the treatment, we can see na ang taas ng ang taas ng anxiety or the social phobia composite. So lahat sila nandito sa level na to. And then when the treatment started so placebo plus self-exposure, so may tinatake lang silang gamot pero wala naman talagang active ingredients yon. So bumaba siya pero hanggang dito lang sa part na yon, sa pose. Okay, ang Prozac plus self-exposure, bumaba siya but hanggang sa after after the whole medication was done, but then the level of the social phobia composite is still much higher as compared with um, the patients who were exposed to just cognitive therapy. So, kung makikita natin, in terms of the efficacy, mas mataas ang efficacy ng um, cognitive therapy. Okay, so going to the psychological treatment. So, again, it's cognitive behavioral therapy. So, ito naman, ang inaano niya is more centered on the anxious thought. Challenging the anxious thought about the consequences of social judgment. So, yun yung trabaho namin dito. Na parang, um, kasi, like for example, may mga sinasabi sila na ayoko kasi ng maisip na may mga taong ayaw sa akin. So, yun, i-challenge namin yun. Kasi nga, again, the reality of life is that not everyone will like us, right? So, parang what uh, the way that others think about us is something that we cannot control. Ang kaya lang nating makontrol is how we will present ourselves to them. Kasi may chance din naman na magbabago sila ng iniisip sa atin kung masama yung iniisip nila. So, yun yung inaano namin dito, pinapoint out namin, or one of the examples of how we challenge the anxious thoughts of the person. And then, another would be yun, exposure approach. So, may mga videos or may mga movies na based on this idea. Yung isama sa party, tapos may assignment si therapist doon sa client na makipag-usap ka sa ganitong karaming tao, tapos ganyan. Or minsan rehearsal, papapracticein, or role play. So, how would you interact with people? So, let's say, for example, ako si ganito, si ganyan. Anong sasabihin mo sa akin? And, based on the studies, this is more effective than the medication. Just the medication. And then, the last one for the anxiety disorders. So, the last one for part 1. So, we have the selective mutism. Okay, now the selective mutism, this is a rare childhood disorder characterized by a lack of speech. Okay, so just to clarify, it's not because that the child is mute. May capacity for speech pero hindi lang siya nagsasalita. So, usually nakikita to doon sa school, yung mga bata na first time pa lang ipasok sa school. So, some of them would show selective mutism, and it's usually occurring for more than 1 month and cannot be limited to the first month of school. So, ma'am, bakit ganun? Usually for a child who is new to the school environment, developmentally, we would give them around a month to adjust. Pero kung after a month or so, wala pa rin, hindi pa rin siya nagsasalita, there might be a problem. And with selective mutism, it's usually, or it is seen to have a high comorbidity with social anxiety disorder or social phobia. So with this one, the treatment for this one, just like with other anxiety disorders, CBT is the most efficacious, and it is also similar treatment for the SAT. Okay, so I hope you have your questions prepared for this part 1. of the anxiety disorders. We will discuss it further later, or when we are in our synchronous class. So please prepare for uh, the post-test then. The post-test will happen after all of the disorders were discussed. Okay? So, okay. So please make sure that you're going to read about this as well.